distinguished guests, respected consultants, healthcare professionals, partners, ladies and gentlemen. On behalf of DKT Nigeria, it is my pleasure to warmly welcome you to the launch of Avibela Hormonal IUD here in Lagos. Today's event is more than a product launch. It is a conversation about expanding contraceptive choice, improving women's healthcare experiences, and advancing reproductive health outcomes in Nigeria.
DKT is a global organization. We are in over 100 countries across the world, the largest private providers of sexual and reproductive health products, services, and technology. Specifically today, we're talking about family planning, HIV prevention, products, services, and technology.
Avibela came to the building with the group. This is Dr. Kelechi, you know that that's true. This product is coming and the launching is new. So DJ, Dr. Kale, this mic is for you.
DKT Market Global is part of the DKT International Group. We work on the upper stream of the distribution chain. So like Professor Luole was saying, when he mentioned supply chain gaps when it comes to access to contraceptive use, that's where we actually play. So we don't just support country programs, we also support other NGOs, implementing partners that are willing to get commodities for implementation.
Hey, you can dance, you can move, but you know you can do all the things that you do. Hey, when my brother get the PS, any girl that sings, you will love him over here. If I check Avibela, my brother will dance well.
Avibela is different. Avibela is unique. Avibela is beautiful.
To come from the perspective of public health, as a public health professional. When you have just one product dominating in any sphere, any field, there's not enough access because of the cost. For me, the excitement here is having another brand come into this hormonal IUD space so that it drives the cost down.
I'm going to assume that this one will be a game changer in the sense that we're able to access it on time and our clients will be able to have access to them and use them as appropriate.
I believe that they must have worked on existing problems before producing a new one, not just introducing an IUD.
Talking from the point of the clinician and also being in a teaching hospital environment. And I remember those days in my residency, one thing that is target in family planning is that we keep continuing to look for that one that will eventually meet that woman at the need of spacing and also reducing the family size. And this comes well enough because of the two main advantages that it has aside from the family planning and that fact that you can use it to manage other gynecological conditions.
I think we need something that can make the clients more comfortable and more receptive to family planning. So if it's coming at this time, I think we have not really missed it. We are good to go.
DKT is launching a new drug. It's a very good drug.
It's been an amazing launch. The quality of speakers from even the company themselves, the specialists, the professors, the practitioners, doctors, nurses, like all the stakeholders that I've spoken today, they've really touched on a very important pain point, which is making sure that we have access to contraceptive for women.